See, the brain or is separated from the nose by a very thin bone called the skull base, and it extends right from front way back. And the brain is actually divided into three parts: the anterior cranial fossa, which is right here; middle cranial fossa, which is around here; and the posterior cranial fossa. And the all these cranial fossas are actually accessible through the nose. And I think it all started with our success in being able to repair skull-based defects with the endoscope. We were able to close small defects through the nose and patch them up. So surgeons discovered that if we can close small defects, why can't we close larger ones? So they started closing large repairs. And then they started thinking that if I can close a large defect, why can't I create a defect and then close it? And why do you need to create a defect? To remove a tumor from the brain or something. So now surgeons are able to create very huge defects in the skull base and to be able to fix them. And through that defect that they create, they are able to remove very large tumors from the brain, things like meningiomas, pituitary tumors, craniopharyngiomas. All this is being done currently. So that I think it all started off with the endoscopic sinus surgery, being able to remove small pituitary tumors, and that has sort of evolved into a major skull base surgery. First of all, I think the requirement is that the tumor or that we are dealing with must be accessible. It cannot be in the center of the brain, So it must be accessible. It must be related to the skull base, to the bone that is separating the brain from the nose. So there are some conditions that fulfill that criteria. Some tumors like pituitary tumor I mentioned, meningiomas, craniopharyngiomas, some squamous cell cancers that affect the nose. So these are some of the tumors that are successfully removed through the nasal cavity.